to go to a drive-through site. If you're a person who's relying on public transportation, like at least 30% of people who live in the city of Detroit, you can't take a bus to a drive-through testing site. So we've put in place models like new brick and mortar test sites, 17 new brick and mortar test sites in the city of Detroit. We've innovated a mobile testing model that has specially outfitted vans that will drive testing capacity to a hard hit neighborhood or zip code or community center or jail or prison or nursing home or homeless shelter, places where we know vulnerable people may be. So we can make testing more accessible. We can bring the testing to you, whether you haven't been go to it. Next piece that we're looking at is the kind of protocols for people who may be working. Black men are overrepresented in some of these jobs that have been working throughout this whole pandemic, whether it is bus drivers or utility rotation in the Department of Public Works. By having to go to work every day during this pandemic, you're putting yourself at risk of infection. If you're a first responder, a police officer, firefighter, EMT, et cetera. And so we work to establish some stronger workplace protocols and protections for those folks, but also enabling infrastructure for people to be able to isolate so that you don't spread this to your household. It's the thing that people have been most afraid of who are working, that I might get infected and I may go home and infect my loved ones. So we've set up models like in the city of Dearborn where first responders can drive through, get a test, and then isolate right there at the Center for Performing Arts off Michigan Avenue. So we try to put in place these kind of mechanisms. The last one that I think is relevant for this conversation is we recognize that one of the reasons why so many people have had such poor health outcomes in general is that a lot of people in our community don't have doctors, or they don't visit a doctor regularly, or they don't have insurance, or they're underinsured, or there's not a doctor that's located in the neighborhood. So we are using the fact that a lot of people are coming into contact with a medical professional for the first time, or for the first time in a long time during the context of this pandemic. And we're using that opportunity to connect them to longer term primary care, piloting a program with Wayne State Physicians Group that is making sure that we can get a solid survey of people who are waiting for care or waiting for a test or waiting for their test results, to be able to understand their connections to the healthcare system and then bridge those gaps where they don't have a primary care provider. That's important for a few reasons. One, to help manage, should they test positive, to help them manage their plan to manage their coronavirus or COVID-19 infection. Two, the doctor long term, which we know is important to being able to be. And the third thing, for those of us who have chronic conditions, high blood pressure, diabetes, asthma, all of these sorts of conditions, which happen to have been shown to be quite deadly when mixed with the coronavirus, you can better manage those conditions if you have access to care, if you have a primary care physician. So making those connections, we think, is important to dealing with the long-term work of addressing health disparities, particularly when it comes to race and ethnicity. So that's what I've been focusing on when it comes to the pandemic. We have some bigger picture things we're looking at, such as environmental factors. The fact that Black folks are so much more likely to live in places that are heavily polluted. And we're thinking about, I live in Corktown in Detroit, right next door to the zip code with the highest upper respiratory infection rate in the state of Michigan because of all the plants and the oil refinery and all that stuff that is there. So how can we help mitigate those environmental factors? How can we also use the fact that internet access, if it was more readily available, would enable people to experience telemedicine services and remote diagnostic services that can help them manage care, especially when it's, especially the time when it wasn't that safe to go out. So things of that nature we're trying to address as well. So that's front of mind for me. I love that men's health is front of mind here for this summit and these professionals and all the people who are participating in this. If our men are healthy, our communities are healthy. If our Black men are healthy, the Black community is healthy. And so I thank you for your commitment to this and know that you have an ally in this work and in this realm, and you're Lieutenant Governor here in the state of Michigan. So thank you very much for having me today. And I appreciate you, and good luck with the rest of the day.
Thank you, sir. I appreciate you. But before you go, I have one other question for you. The other day, you and the governor participated in a protest. What was that like for you?
Well, so for those, many of y'all may not know me or know my history. I have a kind of interesting background in the sense that I'm a software developer by training. Software developer to become a community organizer working on stuff after Barack Obama became president. And so protesting and marching in the street and organizing rallies is nothing new to me. And so it felt good to be able to be out there with people who were calling for change and calling for justice and really letting out screams that we've heard for far too long, for generations. The night before, I had a conversation with my father, who went to McKenzie High School in Detroit. He went to high school with Malice Green, and many of you may remember that Malice Green was killed by the police. Gosh, it had to be like 93 or 94. And that is something that I still remember seared on my memory as a child. Having these same sorts of conversations. So I think it's important to be out there. I share my own personal stories about my interactions with law enforcement as a Black man, and the ones that have been negative, because they mostly have been, but also how we can move forward. We've started the ball rolling with some initial policy reforms that we have enacted at the executive level, including changes to the ways that officers are required to be trained when it comes to de-escalation and use of force, implicit bias training to help improve relationships in communities, particularly when police officers don't look like the communities that they're serving, as well as a continuing education requirement, because a lot of times in a lot of forces, officers will get trained when they begin their service, but they may not have another comprehensive training experience again. And there are very few professions upon which that's true. Teachers have to get trained, have to continue their education and continue to train. Medical professionals, they're training and education, but we don't necessarily make sure that we're checking out law enforcement as well. Law enforcement officers are not required to get periodic mental health screenings. And that's really problematic because it's a really stressful job. It's a really hard job. They deal with really complicated, dangerous, and stressful situations, but we're not checking in on our officers' mental health consistently enough. So these are all part of some of the initial solutions that we have put forward. There's a lot more that can be done at the local level, at the state level, and the federal level. So I'm going to continue to be a champion for those as well.
And Governor Gilchrist, we appreciate your time this morning. We appreciate you joining us this afternoon. And you have our support. Thank you so much, sir.
Thank you, everybody. God bless y'all. Be safe.
God bless. We're going to move right along. I would like to introduce our panel for today. I'm excited to introduce our incredible panel of Black men making positive impact on the Metro Detroit community. They include Detroit Police Chief James Craig, Dr. James Holley Jr., Jason Wilson, and Dr. Herbert Smitherman and Dr. Jason Branch. You all get to know them and their work throughout the event. Each speaker will have an opportunity to present for 15-20 minutes, and then we will take Q&A with the assistance of Dr. Burns. I would first like to introduce our Chief of Police. Good afternoon, Chief. Glad you are here. I would like to read your bio, if you don't mind. Chief Craig began his career in law enforcement in the Detroit Police Department in January 1977. Forced to relocate due to department layoff, Chief Craig began working for the Los Angeles Police Department in January 1981. After holding several high-profile patrol and investigative positions, he ascended the ranks of the LAPD, achieving promotion to the rank of Captain 3. During his tenure, Chief Craig was able to achieve tremendous reductions in crime through the implementation of initiative, strategies, and building strong community partnerships. On August 4th, 2011, Chief Craig was selected as the 13th chief for the Cincinnati, Ohio Police Department, for the first African-American and person outside of Cincinnati to hold this position. He was responsible for leading a department of 1,500 sworn and civilian personnel. Under Chief Craig's leadership, the morale and the rank and file was greatly improved, which equated to an increase in the officers' overall productivity and performance. On July 1st, 2013, Chief Craig was appointed as the 42nd Chief Police of Detroit Police Department, bringing Chief Craig's law enforcement career full circle. Chief Craig is responsible for leading a department of 2,800 sworn and civilian personnel. Chief Craig's top priorities are to abate and reduce violent crime, to increase the morale of the rank and file. Since his inception in July 2013, Chief Craig has made significant changes and continuous improvement to the department's overall organization structure and processes, redefined community partnership, and achieved reduction in crime. Good afternoon, Chief. How are you?
let me start by saying I heard, I think Dr. Burns referenced some folks that may be viewing from Los Angeles and Ohio. If that's the case, I just want to say hello to all of my family in those two places. One place you did leave out, and I can't, most times people leave it out when they do my bio unless I missed it. Portland, Maine. Most people don't know where the great state of Maine is, but certainly that was an interesting part of my journey. But I want to get right into it. Talk a little bit about background, not necessarily my professional background. I want to focus on some of the things I saw here in Detroit, now coming up on my 7th year since my appointment. And I guess it's best to start with a story. I remember probably during my first year, and some of you may remember an event. It was a pretty high profile event on the east side of Detroit, the 7th precinct, where a woman who was obviously had a history of mental illness had killed 2 of her children. And what she did is wrapped them up in cellophane, placed them in a freezer, and those children were there for quite some time. A neighbor called for us to investigate because no one had seen the children. And when my officers got there, they discovered 2 dead children in a freezer, wrapped. And so you can imagine the impact that would have on our first responders. I was physically there that day, so I saw it firsthand. So based on my training and background, I instinctively asked the supervisor at the scene, we probably need to get peer support here because frankly, these officers are mortified, in tremendous distress. And when I said peer support, I said, what are you talking about? And there was no peer support in the Detroit Police Department. And for a major city police department, I was, surprised, disappointed. And I knew then that we need to do something quickly because we talk a lot about PTSD among our heroes that serve abroad. But sometimes we lose sight of the impact of stress and PTSD on our first responders who deal with crisis every day. Also, we don't oftentimes think about our young men in the community who grew up in neighborhoods that have either been a victim of a shooting incident, witnessed shooting incidents involving family members, and the impact that may have had on them. And I think now we're at a place where we're having that conversation more. But in response to what we did in the Detroit Police Department, I very quickly put together a peer support. It was widely accepted, well beyond what I thought initially. I didn't realize that there was such a need until we started embarking. And that's something that we still use a great deal now. It's no secret that over the last several years, we've had some tragic events involving Detroit police officers that were shot in the line of duty. In some instances, they made the ultimate sacrifice. I can't stress enough to you how important it was to provide care and support for the men and women who would respond out to the hospitals, see their partner, whether or not he's going to survive this tragic situation. We have had to have it. I'm not totally publicized this, but many times if an officer is shot and he dies as a result of the injury, that station is not in operation. We will bring officers from other parts of the city. In one instance, the MSP had to come in and carry one of our shifts, the same shift where the officer was assigned to. So it's impactful. So we have a robust peer support program, but there was another area that I felt strong about, having spent the lion's share of my career in LA for 28 years, I was indoctrinated to really understand and embrace the whole notion of fitness. And while I had, growing up here and graduated from Cass Tech, I ran track on the track team. So I already had fitness regimen, but going to LA, it really was taken to the next level. And I realized then the importance of police officers staying fit for so many reasons. One, it's a survival issue. A police officer many times can be in a situation fighting for his life, and it just may be that person's level of fitness that they might survive. And so, and then LA's different. I mean, it's Hollywood, it's appearance thing. And so many of the police officers, maintain high levels of fitness, if for no other reason, just the appearance. And the community responds to a fit officer very different. And so one of the things that was very clear to me, both in my time in Cincinnati as chief and then here, fitness was not a priority. And you can't demand police officers to stay fit. I mean, when you start demanding and say, well, as part of your job expectations, we expect you to run and lift weights, certainly that's a union issue. And the first thing people will say is, well, are we going to get paid to stay fit? And I'm not necessarily opposed to it. I think that would be a great way to spend tax dollars because it has such a profound impact on how police officers will serve their community. And so we started something called DPD Fit in concert with DMC. Like our peer support effort, been a big hit. And so a lot of the men that were in bad shape, poor diets, so many underlying health conditions, and then you fold in stress. It's no secret that being a police officer anywhere is a high stress occupation. And so, the fitness, diet, healthy living is so important. So like Cincinnati, I encourage the officers to engage in a fitness program. And again, to my surprise, it was embraced. So much so that a significant number of our department is now involved in what we call DPD Fit. Our stations have all been programmed to have fitness centers embedded in them. One of the local gyms here has been kind enough to donate Planet Fitness. We have several embedded police station gyms that are Planet Fitness. So our officers can work before shift, they can work after shift, and it certainly has made a difference in really their response to the community, but also how they take care of themselves. We're seeing reduction in sick time usage. It certainly has a direct impact on morale. So I wanted to bring that up as a way of background because I think it's important not to understate, and this is not just, we talk about our first responders, fire and police, but I mean, for the community, one of the things that is appalling today is the absence of fitness in many of our schools. And what impact is that having on our youth community today? And so I'm gonna jump, I know you had a few questions for me, and I'm gonna kind of weave them in and then take whatever questions you might have. We talk about what efforts has the department made to encourage young men to not be involved in violence. One of the things that's worked very well for us here in Detroit, and some may have heard of it, called Ceasefire. Ceasefire is an initiative that actually started in Boston. There are different iterations of it in different cities. When I was in Cincinnati, we had a ceasefire model, but it's really an opportunity to look at and identify young men mainly who are prone to being killed or involved in violence. And so you do it through the criminal justice system, whether they're on probation, parole, they've been in jail, or they're actively involved in gangs, and really going in and calling this group of young men in, sometimes anywhere between 30 to 50, and having a direct conversation about poor decision-making and the impact of those decisions, jail or death. And so we have found that it has had a pretty profound impact on reducing gang and group-related violence. One thing in Detroit, one thing is very different than the other cities. We typically have these, we call them call-ins, where we call in young men from the communities We usually do them once a month. Of course, because of COVID, we suspended that program, but we believe it's had a big impact on reducing that type of violence. Now, we still have this senseless argument based where people get involved in an argument and it quickly escalates to someone using a gun to settle that beef. And so that's something that we continue to grapple with. The other issue, COVID. It's no secret that Michigan, Detroit in particular, was a hot spot for COVID. And I want to talk a bit about how it impacted the police department. Detroit Police Department probably nothing to be proud of, but we were one of the leaders in the country when it came to the numbers of officers we had quarantined. At one point early in the epidemic, we had 650 officers quarantined. So many of you might be wondering, well, how did you effectively police the city? I mean, that takes out a substantial staffing in the department. So we had planned for it. We anticipated that we didn't know much about COVID and the impact it would have on our department. But with 650 quarantine, it was substantial. So we had to shut down some of our support units so that we could realign them to do one thing. The most important thing is handle our emergency calls for service. And so we did that and it worked out. But as a survivor, because I was one of, I think now there's 323 members of the department that have been COVID positive. Our numbers have started to drop substantially. A lot of it has to do with just discipline. Had we known, we didn't know much about the disease, but I guess over time we learned the importance of using the PPEs. We knew that in the police department, we were infecting each other. And so we had to create those safe distances. We had to make sure we were wearing our mask and cleaning surfaces. And then we started to see a dramatic decline. As of today, we probably have a total of 13 quarantine, which is a dramatic difference from just a couple of months ago when we had 650. So I certainly applaud the leadership in the police department for remaining disciplined, but I can tell you many believe that we're ready to take this victory lap. I'm not yet convinced. And when you look at the number of protests that are now occurring all over the country, there's very little in the way of social distancing. Some are wearing the mask, some are not. And so are we going to experience a spike? I hope not. So we're going to continue. I'm going to talk a little bit about the protests, because I know that was one of the questions. You know, as you look across the country, and we've seen the protests primarily in the major cities that quickly erupted into violence. The one thing that's very different here in Detroit, we didn't see the level of violence. Was there violence? Yes. Day 1 and 2, there were attacks on our officers with projectiles ranging from railroad ties to bottles, small boulders, and fireworks. The second thing was the damage to police vehicles. I think we had a total, we're up to about 6. That was day 1 and day 2. But then when I look at some of the cities across America, my old home of LA, Chicago, I think Philadelphia was ravaged by the violence. I would tell you, we didn't experience it. And so a lot of the national news outlets have wanted to hear from Detroit, because many believe that if there was going to be unrest anywhere in America, it was going to be more profound here in the city of Detroit. And so let me first start saying how thankful I am of Detroiters. We know that many Detroiters did not participate in the key protests, and I'm not talking about the other planned peaceful ones. I'm talking about the protests that started off peaceful, but later during the protest march erupted into violence. The people that we subsequently arrested anywhere between 65 to 70% were from outside of Detroit. Many from the Metro Detroit area, and then certainly a smaller number from outside the state of Michigan. And the question I've always asked, but I know, is that why are you here? We arrested 3 New Yorkers several days ago. New York's got protests. Why are you in Detroit? California, we had 1 from California. Were you traveling here for a vacation, or you had another agenda? And so what we found, Detroit was no different than well-placed provocateurs, if you will. I'm not going to attach a label like what you're hearing, but certainly they were embedded in the peaceful protesters, and it erupted. But here's what worked here and what is working, and I'm not ready to take a victory lap yet, but because of our relationship in our community, and the fact that we had community members embedded in the protests made a world of difference. Because Detroiters have spoken one voice. One, we want to know why you're here. And secondly, you're not going to come here and burn our city down, damage property, and attack our police officers, which, when you think about a lot of the issues that are going across the nation relative to the relationship between police and community, I can tell you that nothing's perfect, but we have done so much, not in response to this issue, but over the years, building those relationships of trust has really gone a long way into where we are today. You know, many departments will wait for something bad to happen, and then they start responding. You know, we've heard some of the stories about in Minneapolis that Mr. Floyd's death was just one of many issues impacting that city relative to police-community relations. And so we don't have that here, not in general. I mean, you may remember the death of the young man on the off-road vehicle at the hands of Michigan State Police. And then there was another shooting death here in Detroit involving a man who was shot, I believe it was by an ICE agent. And those 2 events rocked the city and could have very easily escalated up into civil unrest, for it not because of the relationships that we established. And even though it wasn't the Detroit Police Department that used deadly force, because we're the face of the city, we had to respond. And it's really behind, you know, the relationships. And those are really the key.
One second. I do want to have an opportunity for our participants to ask a few questions of you before you leave. So I just want to do a reminder that they can also text a few questions to 313-356-6241. Again, that's 313-356-6241.
Did I go over my allotted time?
You are good, sir. You are good.
Okay, I'm done. In fact, I was in the process of wrapping
You are
it up.
good, sir. If Dr. Burns can give us some, go to the Q&A questions so we can answer a few questions, sir. Thank you.
No problem.
Hey, Derek. We do not have any Q&A questions, but we will be releasing a poll on some of the things that Chief James Craig just had mentioned. So if you have any other questions on your end, that would be great.
I don't have any questions. I don't know if Mr. Ware, you had some. I know you had some.
I do have a question for you. Being a COVID-19 survivor, how are you doing, and how are you mentally handling this with your department?
Very strong. You're talking about how am I handling it mentally with the department concerning COVID, or both COVID and some of the protests that have become violent? Well, the key, and I'll just break it down as simple. You know, I'm blessed. It was not an easy fight. I talked about it in the aftermath. One thing I didn't want to do, and I know this is about Black men seeking out, you know, health, go to your doctor when you need to. I was working with the chief doctor at Henry Ford once I came back positive. and they had a bed waiting for me. I didn't want that bed. I mean, I knew there were so many others that were in dire need of treatment, whether it was oxygen or vent. And so while I was sick and I was battling this deadly disease, I didn't feel, and having underlying health issue, at least one, I was very concerned. But I think the key that got me through it, and I've said it publicly, first prayer, but secondly, just my fitness regimen. Fortunately, I didn't rely on the outside gym, and all the outside gyms have been closed. But just maintaining a workout against physicians' advice, they take it slow because the disease will take you down. But I'm a fighter, and I decided it was important for me to fight. And I think when you look at the array of folks that have been stricken by COVID, maybe it's too early to say, because some in the department, we've talked, those who have had a certain level of fitness typically did better with the disease. Although there was one member of the department who approached me and said, I don't know why I didn't have symptoms. I smoke, I'm fat, and I'm not sick, which I found it odd. But so I guess as we continue to research, we'll find more information. But it was really the fight. And so when you're talking about leadership and dealing with stress, you have to maintain calm in the presence of a threat, whether it's this invisible enemy we call COVID, or whether it's this other enemy that we're now dealing with, who is disruptive and has been a problem throughout this country with our protests.
Thank you, sir. We appreciate you.
We have them rolling in now. They're rolling in fast. So real quick, what are your thoughts on the Shelby Township Chief's comments? Could you quickly, briefly, or answer that question, please?
Briefly, I could go for a long time on it, but horrible comments. And I've heard some of the response by the community. How can you lead an organization when you make a comment concerning protesters being in body bags? I mean, I've heard some comments, but that by far was one of the worst. And so I think it was appropriate that he no longer sit in that seat, because how can you effectively work as a police chief and lead men and women in the city when you feel that strongly about protesters? I mean, just horrific.
Okay, one more. How are the police departments responding to the idea of defunding police departments?
So I'm so happy you brought that up, because I've been very vocal over the last day on several national news outlets. I think it's ridiculous. I think it's knee-jerk. I think that this is something that wasn't planned out. When you talk about defunding and dismantling a police department, since you've thought about it long and hard, what's the response? And oh, by the way, when you came up with the idea of defunding, have you gone into the neighborhoods who rely on police service, not occasionally, but every single day? So, we come up with these ideas, and don't get me wrong, I'm certainly not dismissive of the horrible things that have happened at the hands of police involving Black men. I was the first police chief in the country to come out within 24 hours of that incident. And while I applauded Minneapolis for quickly firing the 4 officers, but what I was troubled by is that anybody looking at this video could see that officer took the life of Mr. Floyd. And as a practitioner of 44 years and looking at how he restrained his neck, even during the course of the 7 or 8, 9 minutes that he restrained him, Mr. Floyd offered no resistance. In fact, there were cries by Mr. Floyd to release him. He couldn't breathe. There were onlookers, who are the real heroes in this, who simply said, release him. And they were advancing on the officer until they were confronted by his partners. Equally troubling, as I refer to them both nationally and locally, is the police officers that stood by in a cowardly way and did nothing to save Mr. Floyd's life. So based on what I saw, very quickly, I came out and said that the officers should have been arrested immediately. Why? Because as a police officer, we have the ability and the authority that based on probable cause, if you have enough information to believe that a person committed a violent crime, in this case, murder, you have the authority to make the arrest. We don't charge as police officers. What we do is we can make arrests. Ultimately, the charging decision rests with the prosecutor's office. Horrible. And then after that, a couple of others came out with, well, he should have been arrested, because here's where the divide comes in. When you treat a police officer different than a member of the community, that's when trust erodes and the community really becomes divided. And look at the response by our nation.
Okay, we have several by phone, like text messages via phone. Derek, what would you like to do?
Can we answer one more question and then we'll move to the next presenter?
Okay, what is your plan in regards to the use of force and racist tendency?
Force, well, we're not an organization that responds.
I'm looking at it, I'm sorry, in terms of training the police officers.
I understand. We didn't start training just yesterday. In fact, as you may recall, Detroit Police Department was under a 13-year consent judgment, federal oversight, 13 years. And part of the federal oversight mandated a training dealing with the mentally ill, use of force. We have a model use of force policy. And as the Lieutenant Governor indicated statewide, looking to create something for in-service training, like they do with like a medical professional. We do that now. And so the one thing that I just want to leave everyone with, that one size doesn't fit all. And one of the reasons why I've received so many calls from chiefs from other cities, people want to know what is working in Detroit. Are we perfect? No. But the fact that we have adopted best policing practices, that makes a difference. Now, I can't speak to some of these smaller agencies that make up the police departments across the state of Michigan, but we have a very robust use of force policy. And I think the key takeaway is tenured officers are required to go to 40-hour training every year. And so we take it serious, and it's a mandate.
Chief Craig, I want to thank you for participating with us this afternoon. We appreciate everything that you're doing for the city, and you have our support. We love seeing you out in the community like you are. Again, on behalf of Detroit Community Health Connection, the University of Michigan, and the other panelists, we appreciate you taking time out of your schedule. Thank you, sir.
And thank you, Mr. Ware, and to all the panelists. I appreciate the opportunity, and you all have a great day.
You too. Appreciate it.
Okay, thank you.
Once again, I want to give the phone number for Q&A. You may text that to questions to 313-356-6241. Next, I would like to introduce our next presenter. That's Dr. Jason Branch. Dr. Branch is a licensed professional counselor for the state of New Jersey and approved clinical supervisor. Dr. Branch has more than 15 years of experience in mental health counseling professional. Dr. Branch has worked in the community agency, mental health centers, city government, and substance abuse treatment facilities. Dr. Branch has maintained a clinical private practice since 2010 that focuses on adults, adolescents, couples, and families. Dr. Branch currently engages in professional and scholarly work focused on African-American male experiences, mentoring, multicultural issues, and increasing the practice of self-care for helping professionals. Dr. Branch, how are you, sir?
Hello, can you hear me?
Now we can, sir.
Okay. All right, I'm doing well. I'm doing well despite everything that's going on. I really appreciate this opportunity to speak to you all, to serve on this panel with a lot of experts. So I greatly appreciate the opportunity. So I want to dive right in, and I get really excited. I get excited talking about counseling. I get excited talking about counseling for Black men, for Black people. So I'm gonna try to put everything together without going too fast, but the reason I speed up is because I get so excited. So I'm excited to talk about counseling mental health, especially for people of color. So the reason I got into this profession, just curiosity. You know, I took a psychology course in high school and it just stuck with me. And psychology took me into counseling. I didn't know about the counseling profession at all. And a lot of us as Black men, we don't know what we hear about it. It may not be the nicest thing, meaning, you know, I don't need help. I don't need therapy. I can figure it out on my own. So that's what I was faced with and didn't know. So as a master's student, I was in my second year in the master's program, learning how to become a clinician. And one of my professors mentioned, hey, you know, it's important for you to experience counseling for yourself in order for you to provide it for others. And I was just like, yeah, I'll go eventually, no big deal. And I scheduled an appointment and I didn't go. I canceled. And it happened again. I scheduled another appointment the second time and didn't go again. And the third time I scheduled the appointment, luckily my therapist was really patient with me. I scheduled again for the third time. And when I went, it was on campus at the Wellness Center. And I'm looking around, seeing who sees me going to this building to get counseling. Mind you, I'm a second year master's student learning how to become a clinician. That's when I knew this stigma and belief about counseling mental health was really heavy for Black men. So when I went to therapy and, you know, I didn't want to put my name down on the paper, I was terrified, but I was a master's level student, which doesn't make sense. So when I finally got over myself, got in, you know, sat down, my therapist was a Black female, and I poured into her like she was Oprah. It was easy. It was just natural. It was fun. I didn't know I had so much stuff that was just piled up that I held on to. And that was the first time that I was able to release it. And that was over 13 years ago. And from that moment, that's when I decided I'm going to dedicate my life to the counseling profession, especially for people of color, more specifically for Black men. So what is counseling? Counseling, typically you have 50 minutes with someone who's non-judgmental, non-biased to help you help yourself. That person's role is to hold up a mirror to you for you to see things that you just may not be able to see. The person can guide you in different ways by offering suggestions, recommendations, but a counselor's job is not to give you advice, meaning you are the expert of your own life. That person's job is to help you help yourself. So that's some of the misconceptions that a lot of people have about counseling. I don't want to go somewhere where somebody tells me what to do. That's not our role, that's not our job, but that's a belief that we have that's been passed down for many, many years. Understand that with counseling, it's, you know, you get in, you get out what you put in. If you go to counseling, you don't feel as though it's going to work, you're not going to do anything, you're not taking any suggestions, then it may not work as well for you. For those who experienced counseling, who went, did not like it, or you connected with someone who didn't look like you and it made you decide not to go, that's understandable. It happens. There's not a lot of us as, you know, Black males therapists in this profession. So it may be hard to find those clinicians. So I'll give you some resources once we finish the conversation. So it happens. But with that, please go back. If you tried it once, go back, try it again, try a different therapist. One thing that I notice about us, especially as people of color, we give certain people opportunities. When it comes to clinicians, you got one chance. You either get this right or we're done. But when it comes to McDonald's, we give them chance after chance. How many times you went to McDonald's and the machine was broke? How many times did you stop going? Not yet. So therefore, that mentality, that resilience that we have for McDonald's, can we have that when it comes to our mental health? Can we have that when it comes to us taking care of ourselves? So some of the beliefs and myths and stigmas about counseling mental health. Number one, for a lot of people, there's not any clinicians that look like me, so I'm not going to go. The truth is, counselors, no matter race, color, creed, sex, they are trained professionals to help you. Doesn't matter what you look like, doesn't matter who you are, what you do, they are trained to help you. They are trained to deal with their own stuff, their own selves, to be able to help you. Now, some clinicians, they aren't that great. They haven't done their work, so they may not be that great, and that's okay. There's others who are that great. And some people may not be a good fit for you. It's finding a fit that works for you, which means if you're working with a therapist and it's not working, you can let them go. You can leave and go somewhere else. Don't allow anyone to stop you from living your truth. So that belief, that idea has to be a Black person. Not necessarily, it doesn't. And if you feel more comfortable with a person of color, we exist. You just have to do the work to find us, find out what we are. Another myth, it costs too much. Yes, counseling can be expensive. And part of counseling being expensive, we are trained professionals. I've earned a PhD, I have a master's and 2 bachelor's degrees. I earned my spot to be able to provide service for you. So yes, I would love to be compensated for the work that I do. However, everyone's fees are different. It's based off of the state, their location, where they are, what they do, and what they offer. Find a clinician who's able to assist you. So the rate can be changed. Also, if you have insurance, you can use your insurance to get a discounted rate. And some clinicians, including myself, offer pro bono services, which means absolutely free. So I leave space available for a few clients to be able to offer services for free. I feel as though this is my passion, that's my role, and that's what I can do. And I know I'm not alone. So you have to reach out. Also, negotiate. You can talk. You can let your therapist know, hey, I don't have the money to pay your fees. Can you offer a discounted rate? Can we do half price? Have those conversations. And for whatever reason, we feel as though we can't really talk to that person, but you can. So reach out and connect with them. Also, for men, this idea of if I go to therapy, I'm weak. Truth is, therapy gives you strength. Therapy takes you to the next level because you're able to uncover a lot of things that you've never had a safe space, a brave space to share things that you're dealing with. And a lot of us as men, we're dealing with a lot of stuff and we don't share with anybody. That's your opportunity to share it with others. And for some of us, even growing up in the Black family, religion, church has been one of those core values of where we get help. But last time I checked, God brought us therapists. God brought us people to support us when it comes to taking care of ourselves. So that also plays a role. So I want you to understand how deeply rooted these beliefs are that we live by that prevents us from doing things to take care of ourselves. So for example, I like to share this story often where some of you may be coffee drinkers. Now, in order for you to be a coffee drinker, there's a system that took place. And that system is real easy. You can write this down if you want. And it starts off with a belief. So all of us have a belief about something. And your belief determines your behavior. So if I'm a coffee drinker, my belief about coffee is the greatest thing ever. It tastes good. It's wonderful. I got to have it to start my day. That's a belief because, and it's not a fact because there's a lot of us who do not like coffee. We hate coffee. So how can it be the greatest thing ever if there's other people that hate it? But it's the greatest thing to me, which means that's your belief. So understand, belief determines behavior. So if I believe this about coffee, every single day, I'm going to get coffee. That's my behavior. Over time, my behavior develops into a habit, which means it's like clockwork. I don't even think about it. Every morning, I got to have it. And if I don't have coffee, somebody's going to have a bad day. I guarantee it's going to be me and you if you're a coffee drinker. And what that turns into is a lifestyle, which means no one would ever say this publicly, but I need coffee in order to live. That's my lifestyle. So understand, belief determines behavior. Behavior over time develops into a habit. Habit over time develops into a lifestyle. So being a coffee drinker is a lifestyle. In order to change your lifestyle, you have to change your beliefs first. And to me, counseling is one of those first places that you can go to start the process of changing your beliefs. Now, understand, anytime your beliefs are challenged, you go into defense mode. You want to defend what you believe in. And if you look at everything that's going on in our society right now, you see a lot of people trying to defend what they believe in. And that's hurting a lot of us. So in order for us to start that process, we have to start at least questioning things. A lot of times we don't question anything. We just take what's given at face value. So an example of that, many of you, I know I'm not by myself, have this drawer or a cabinet in your kitchen, in your bathroom that got a whole bunch of plastic bags in it. It's one big bag with a whole bunch of plastic bags inside. If you don't have it, congratulations, you got rid of it. If you do have it, yes, I'm talking about you. Understand why we do this. It's been passed down from generations to generations that you've holding on to these bags. And if I asked you right now to get rid of all your bags, you will fight me on site. You'll have a fight with me because I'm challenging your beliefs. The truth is you don't need 100 bags. You would be okay with 10. You would be okay with 5. But for whatever reason, we're holding on to these bags. And anytime someone tells you to get rid of it, it's a challenge to you, which means my beliefs have been affected, right? So I'm defending myself. So what's the value of these bags? With truth being told, there's no value in the bags. They're worth pennies or less. And you go to the grocery store pretty often. That's why you keep so many of these bags. So that example is just plastic bags. Imagine how much other stuff that you hold on to that have no value, no meaning besides what you gave it. And you're still holding on to these things that's no longer serving you. So a lot of us are holding on to beliefs that do not serve us anymore. They may have a long period of time ago, but now they do not. So imagine how much you're holding on to these beliefs or ideas or identity that you're holding on to that don't have value, especially us as Black men. This idea of what it means to be a man, what being a man looks like, those values may not help. An example of that, the Superman complex. We want to save the world. We want to save everybody. We want to protect everybody. But how can I protect everybody if I'm not willing to protect myself first? How can I take it? Yes, sir.
I need to interrupt. I need to make sure that we get a few questions in here.
Okay.
Before we go along to our next presenter. Dr.
Okay.
Burns, do you have any questions in our Q&A or any on the text message?
Real quick, I think you've covered some of these things, but how do you educate the community that counseling can be a positive experience?
Excellent. For those who have experienced counseling, talk about it. Talk to your friends and family about your experience in counseling. Because if for anyone who hasn't gone to therapy before, it's all beliefs of what therapy is. So if you're a person who've experienced it for yourself, talk about it. Have conversations about it. If it was great for you, if it worked for you, talk about your experience, how you were able to grow from your counseling experience. So that's one. And just having candid conversations about counseling. I feel as though this platform for us as Black men to talk about our professions and what we're doing, where we're going, and for you to tune in, that speaks to your curiosity and your ability to gain this insight. Take this information and spread it. Give it out. You have a Black male therapist here, which that eliminates one myth that there aren't any. You do have one. Now start having those conversations. And to me, it's not about trying to convince someone to go. It's about education first, just educating them on what really goes on in counseling.
I have a question dealing with church. How do you kind of deal with churches or with saying the phrase "pray about it and it'll be okay"?
Yeah, it's common. It's common, especially within the Black community. I think prayer. Well, I know prayer does work. Prayer does help, but prayer is on the spiritual side of things. And in order for us to have this spiritual connection, that takes faith. So I've never met anybody who's, died and came back and told us how it's really going to be. So therefore, that's spiritual. It's not tangible. With counseling, that's tangible. This is someone you can talk to and get responses back. When it comes to prayer, we're talking to God. That's a different level. But when it comes to talking to someone dealing with life issues, life situations, like a trained professional to help you process through things, pray and go to therapy. You can do both.
I agree. Dr. Burns, any other questions in the Q&A?
I have a phone question, text message. For Black men, why is it so hard for many to buy into addressing our issues, be it abuse, death, or vices? And as you're talking, I'm going to release a poll to our audience, but if you could answer that question as well.
A lot of reasons why men, we don't buy in it, because it's easy not to. It's easy to just keep doing exactly what I'm doing, expecting different results, which is called insanity. I'm doing the same thing over and over again, expecting different results. The reason that we don't go is every belief that we've created of why counseling is bad or not good for me, but it may be good for everybody else. And with counseling, there's a level of vulnerability that takes place. And a lot of men, we don't want to be vulnerable. We don't want to be uncomfortable. We don't want to be put in situations where we have to feel, because a lot of times we're working strictly on strength. We've always carried the weight for so long. So how can I dare take a moment to be uncomfortable? How can I dare be vulnerable? I'm not going to allow myself to do it. So I'd rather hold on to the trauma. I'd rather hold on to these things that happened to me than actually release and let them go. And that takes work. And if I don't have anyone setting that example for me, which means other men talking about their feelings and being vulnerable, why would I ever want to do those things? So as men, if you are in a place where you've experienced therapy and you're able to talk about it, share your experiences. You never know how you can help someone else. So I shared my story at the beginning. I am a licensed professional counselor. I have my PhD, and I was afraid to go to counseling. That's how deeply rooted it is. So understand it's probably even more for those who may not have any background in counseling. And I did want to offer a couple of resources for those who may be interested in counseling. Number one, Therapy for Black Girls. This is a great resource. It's a podcast as well for Black women, women of color who want to go to therapy. Therapy for Black Men is another one for Black men. A lot of resources available. One that's global is psychologytoday.com. You can put in your zip code and find a therapist within your area. Scroll through the list. You have different pictures and profiles of different people. Find someone who you feel as though may be a great fit. Reach out to them. Ask some questions. They're going to be able to provide that service for you. And if you connect with someone and you're not really feeling that person, find another therapist. We're all over. Also with telemental health practice, we're able to get a larger reach. For some of you who are interested in counseling, I am in New Jersey, Pennsylvania, Alabama, and Georgia, and I offer telemental health services. You can find me at www.drjbranch.com. So reach out, do the work, be uncomfortable.
Thank you, sir. I appreciate you, Dr. Branch. We are going to move forward with our next presenter. And our next presenter is going to be Dr. James Holley Jr. Dr. James Holley Jr. is a native Detroiter, is a self-identified education engineer focused on using research and scholarship for the benefit of educators in urban settings. His personal mission is to invest in the prosperity of Black and urban youth by helping these young people develop their physical, mental, and spiritual capacity so that they may become mature individuals and active members of society with a keen awareness of the debilitating effect of systemic racism on the lives of Black Americans. Dr. Holley advances his mission through designing educational experiences that stimulate young people's intellectual growth, culture competence, and social political conscience. Dr. Holley Jr., sir, how are you?
Hello, I'm doing all right. Glad to be here. I feel very privileged to be on this panel with some of the other panelists, and even more so to be able to speak to people in this particular moment that we're in. I do want to start off by just sharing a sentiment in that it's okay, or speaking to others, and saying that it's okay if you're not okay. I know that me personally, I'm in the summer portion of my job where it's mostly research, but there were days earlier in the week I had to just step away and focus on my family and daughters and just my own personal well-being, doing things that were either joyful or just relaxing in this moment. So I do, while some people are getting fired up, some people are encouraged, and it's okay not to be okay. I also want to encourage, in relation to my piece now, is just this idea of intellectual stability. I think we have to guard against being underexcited, right? So the thing is just like, it's so much going on and so depressing and dispiriting that we can't see or appreciate the good things that are occurring right now, right? But on the other hand, that is being overexcited, right? A lot of folks are making statements, a lot of things are happening. People are reaching out and asking questions that I think, for lack of a better way of saying it, it's real fast, right? Like the folks who just last week or last month or last year were denying our experience or, dismissing your reality, all of a sudden, fist in the air, Black Lives Matter. So that's on a personal level, institutional level, organizational level. And so I think it's also, we have to be careful for our own well-being that this is a long time, this is a marathon, not a sprint. And we have a history that, we have to move from. And so just cautioning people to really be critical as we move forward. And so if I had to title these, the words I'll share today, I'll call it critical consciousness in STEM education. So off the bat, I'll just, say that even though I have a bachelor's, master's, and PhD in engineering, I am not a STEM apologist. I'm not one of those who just like STEM is the future, STEM is the answer, or those type of things, nor do I feel that way about schooling. However, this is the space that I believe God has put me in. I've been afforded some privileges and benefits to speak and do certain things, and so I operate within this space. So I'm happy to answer questions, to talk about how do we do STEM better. But I'm also not the one thinking that this is something. I value the arts, I value the trades and other spaces that contribute to our intellectual freedom in our society. A little bit about my background, as Derek said, I'm a native Detroiter, and when I went out to college, I went to a historically Black college, Tuskegee University, and I thoroughly enjoyed my experience there. But one thing I knew when I left is that I always intended to come back home to Detroit and leverage any talent, skills I had. I didn't really know what that would look like, but I committed myself to that. In fact, I would tell the story of like when my now wife, our first date, I told her, I was just like, you know, I know we just getting started, but if you're not interested in living in Detroit, then we don't need to go. Like date number 2 is unnecessary. We can stop this right now. And so, you know, for a long time, I've been committed to coming home and trying to figure how I can collectively support and uplift those in this community and be uplifted, right? It's not just me coming to save anything, but also continually being enriched to the community that developed me. So at Tuskegee, one of the things that was really helpful for me was, as I figured out, is engineering really for me? I did well in math and science. I had an interest as a Black male that was encouraged by my support group. But there was something beyond just the engineering content that I gained from Tuskegee. It was a social, emotional wellness. It was I began to adapt this identity as a scholar. So more than just being a student, but feeling as if there's more to this academic enrichment. There's more to academia than just doing classes, getting grades, and then getting a job. And so as I was wrestling with that, I wasn't necessarily convinced that I wanted to be an engineer in terms of industry and professionalism. But what I appreciated was this concept of engineers as problem solvers. And that can be really translated to a lot of different contexts, right? We have all types of problems, but engineers, there's this idea of using formulas and particular methods to address problems. And so that intrigued me. And so I had a professor who was just like, you know, she affirmed my intellectual capacity. And so I connected with her and she helped me understand graduate study. And so I did my master's in mechanical engineering at Michigan State University. And once I got there, it really was a trial period to see, do I want to continue with engineering or do I want to transition to something else? And I very quickly decided that engineering was not it. Once the numbers became purely letters and derivatives and proofs, if anybody know what I'm talking about, that was the end point for me. And so then I had to pivot. Well, what am I going to do? And so I heard about an engineering education program at Purdue University. And I saw that as an opportunity to merge this engineering training. By that time, it was about 6 years in to my interest and passion for youth development, and in particular, working with Black youth. And so I saw opportunity to then use engineering as a lens to see how can the educational field better serve Black students in the way that we, I guess, evangelize engineering, the way we talk about engineering, and the way that we represent engineering and what it is. How do we do so in a way that affirms and serves and supports Black students? And so that's where I went through and did my PhD. And my dissertation was on the idea of teaching engineering to Black boys as a Black man, really looking at the racial dynamics and the cultural dynamics of my identity and how to inform how I understood the value of engineering, but also how I taught it. And to me, that's critical consciousness in STEM education, is looking at systems of inequity, looking at racism, looking at dynamics in society that influence the way that we teach and learn. And so now my role at Wayne State, I work in the teacher education department, specifically focused on urban STEM education. And so now I'm not just in the engineering space, but I'm responsible for speaking to the broader STEM space. And I'm working with pre-service teachers largely and some in-service teachers. And what I try to do is help them think through what does science, what do the events that we're navigating right now, when we're talking about racism, a country that has been anti-Black for all of it prior to its existence, right, for over centuries. When we talk about things like oppression and economic inequality, what does that have to do with science? What does that have to do with technology? What does that have to do with engineering and mathematics? How do we consider the ontology and the way of thinking and the way of existing and the purpose for being that Black people bring to these subject matter? And so that is how I try to work in the classroom dynamics. STEM has a history of being seen, particularly science and math, as very objective disciplines, meaning there's one right answer. We don't have to talk about what your cultural identity is, or what your preference, or what you look like, those things that are seen as subjective. We're moving our opinions, and we're coming at what is the truth, what is the right way, what is the answer. This mathematical equation has one solution. How do we get there? And when we challenge that, what we see is that, it may be one solution, but there are multiple paths to that particular solution, right? While we're doing mathematics in the abstract way, we have to apply this to something real. And so the purposes of mathematics and science can serve very different, diverse ways for Black communities and other non-white communities in society. So, and then also the ways in which science and mathematics are being displayed. Some of the more popular ways in Black communities, some of the more popular ways that's discussed is, like my hair, right? So when we go get our hair done, there's science in the ways of manipulating and treating hair and understanding hair quality, not in terms of good and bad hair, but in terms of porosity and how well it absorbs water and what type of products you need. There's mathematics when it comes to braiding someone's hair or doing different hairstyles. There's all type of geometry that we allow to be dismissed, not even forgotten or misunderstood. It's dismissed as not valuable. And so I try to find ways to affirm and uplift those spaces and really challenge the traditional ways that we teach and learn. And then thirdly, I talk about is liberatory education. So going beyond, oftentimes the word school is used as not, or education is used synonymously with school. And what I try to do is really try to demarcate those and delineate, like, schooling is a part of education, but education goes far beyond the school culture, the school norms. In fact, for Black folks and Black men in particular, what we've seen is schools have been very detrimental to our ability to learn and grow. And so how do we then shift school culture, school practices, so that we are able to get educated? How do we then educate ourselves about the systems that we exist in and that have not served us well, so that we can actually get to the space where folks are allowed to exercise their gifts and talents in a free and liberatory way? And so, one thing I like to say often is that the greatest potential for Black boys and Black men, young men and older, or whatever the case may be, cannot be achieved under our current educational structure. And that's within the school dynamic, K-16, so not even just pre-college, but also the college and even, I say, K-20, graduate school level. However, intellectual freedom is possible if we commit to struggling and working and really, being dedicated to working out and figuring out and challenging these structures that we're in. So I think it's possible, but I think we're so far from that. And so a lot of my work is around, within the context of STEM, how do we achieve that?
With that said, Dr. Holley Jr., can you tell us or explain to us what STEM education is?
Yeah, so STEM education is looking at the science, technology, engineering, and mathematical disciplines and exploring ideas of one, like representation. So what is it, or identity. So what does it mean to be a scientist? What does it mean to be an engineer? And how are those different? Because a lot of these subject matters or these disciplines are intertwined. For engineering, it's a big mix of science and mathematics that you apply within engineering. And so some of it is identity. Some of it is content. So things like the scientific method. What are the ways of discovery and inquiry? Also things like the nature of science. What is it? What is science? When we say that word, what do we mean? What is mathematics? So I think a lot of it is the content piece, but also digging into and how do we teach it? How are people learning it? How are they processing? But also identity is one that's becoming more popular and recognized as a major aspect of STEM education.
What are you doing, or what is Wayne State doing to recruit or to let youth know about the program?
When the teacher education program in particular, or
STEM period?
STEM. So one of the biggest educational initiatives that Wayne State has are summer programs. And so one of those large programs is C2 Pipeline. It's a STEM-based program that initiated within the medical field, but they address all the components of STEM. And so it's been shifted, of course, given the pandemic, to be an online and virtual experience this year. but that's a regular program throughout the school year, actually. I mean, throughout the entirety of the year that exposes K-12 students to STEM. Another one is, trying to think of the acronym, I'm sorry. But so I can post a website. I don't know, I'm off the top of my head, but there are many different K-12 engagement programs. And so some of that is explicitly called STEM. So they cover all subject matter, but some are offered by particular colleges, like the College of Mathematics or College of Engineering, where they do their own programming to bring students on campus.
I have one more question, and then we can go to Dr. Burns for Q&A. What innovations, if any, can you see being implemented to improve the health of the community, our community?
So I think in a broad sense of health, I think pedagogy is one of those areas. Pedagogy is the practice of teaching. And right now, a lot of teaching is framed in terms of deficits, like what supposed deficits Black students do not have. And so I see innovatively, if we reframe, and as we look at the disparities and disconnects between how students are, the outcomes of students in the ways they're performing, shifting it from what's not there and what's wrong to saying what do they have, what resilience are they displaying to show up to the classroom and engage, what issues are happening in their home and community setting and national setting that we can leverage and connect with science content, math content, and engineering content. Actually, somebody just asked a question, the SMASH program, that's the one I was looking for. So the SMASH program is another K-12 program that focuses on rising sophomores, and they come on campus and they learn about engineering and how it connects with their cultural identity. And then it's a multi-year program. So they come as, I believe, sophomores, and they return during their summer after their sophomore year as rising juniors and things like that. So thank you, someone asking about that. And I could answer that question, I guess. Well, I brought that up. Okay. So to answer that question, how are they using the SMASH program? I think one is just the exposure to the campus. Regular exposure to the campus allows students to go beyond just seeing a pamphlet. It connects them with particular people. I've spoken at some of the SMASH program events, so people are able to see faces and get familiar with the facilities. But also what SMASH does is gives experiential enrichment. And so if I Google, and actually it was my experience when I was coming out of high school, I didn't really know what engineering was. Someone suggested it, and so I went to Google, and that's how I made an assessment on whether it fit who I am or what I was trying to do. So it takes from this abstract or generic or web-based definition of terms to give them applications to really explore, get their hands on some things, have conversations, ask questions in a very real way. And so through those connections, then they also, they have admissions officers and different people present to the students throughout the summer program. So there's this kind of informal, just by them being there in the process of it, but then there's the formal admissions officers who make their pitch and try to recruit in that particular way. And I think with students coming multiple years, that also familiarizes them with the campus and the culture.
Dr. Burns, do you have any questions in the Q&A?
I have on the phone a text message that says, what strategies can Dr. Holley offer to change the structures in K-12 to make the system more accessible and engaging and less detrimental to the educational process of our Black male?
Okay, thank you all for that question. I want to answer somebody that's follow up SMASH. I currently do not know that data. I'm not a partner with SMASH, but I'm not actively on their staff. So I don't know the data around their effectiveness of recruiting Black students. The strategies in terms of shifting K-12 culture, one of those, I believe, is where I am in teacher preparation. So initially when I was graduating, I thought that I wanted to go directly and work with schools. And what I realized is there's so many different issues that students have to, teachers have to navigate that they may not necessarily have the time or bandwidth to bring in what's considered best practices or external things. And so if I can help teachers on the front end see this as a part of their role and their work, that's particularly what I do, is in their preparation, seeing that these cultural dynamics, things like racism, are not abstract and disconnected from your content. Another option is I have a shirt, I am in demand. And so that's a buddy of mine, Quan Nellums. He has an organization called I Am in Demand. And so their website, IamInDemand.com, recruits Black men in particular to engage school systems. So I think bringing in community partners as affiliates and active people within school systems spreads the work and responsibility. And I think schools have gotten away from that. And so what data has shown is that Black males in schools make a difference, not just in general in disciplinary roles or just showing up, but particularly those who are teachers, and even more so those who enact culturally responsible pedagogy. And so connecting folks within schools and raising up teachers and administrators, but also those who education is not their tradition, their professional field, but they have an interest in serving Black boys or serving those who within the school, connecting to organizations like I Am in Demand, you can leverage your talents and skills and just your energy to shift the culture and vibe in schools.
Dr. Burns, any other questions?
No, I just shared the poll about people being exposed to STEM programs. So please continue to participate in our polls. And also, if you have anything to share, please tweet that or add to the chat. Most of the questions have come from our text. So that's pretty cool too.
Dr. Holley Jr., thank you so much. I appreciate you, sir. We're going to keep moving. Our next presenter is Mr. Jason Wilson. Mr. Wilson is the founder and CEO of the Union, a nonprofit youth development organization in Detroit, Michigan. Since 2003, the Union has effectively reached more than 15,000 youth and young adults through innovative prevention programming, trauma-informed care, parental engagement, and counseling. In 2009, Mr. Wilson's heart for fatherless and misguided Black boys inspired him to create and direct The Cave. An expert in emotional stability training, Mr. Wilson's leadership has carved the CATTA, which is carved, numerous acknowledgments and awards for his work teaching males how to introspectively confront and conquer their negative emotions with composure. In 2006, one of the CATTA's videos went viral with over 80 million views worldwide. As a result, Mr. Wilson has invited to be the guest on the Dr. Oz show to present The Cave at President Obama's My Brother's Keeper showcased at the White House. Later that year, NBC hit TV show This Is Us was so impressed by Mr. Wilson's work, they featured the Cave Initiative ceremony in one of their most viewed and award-winning episodes. In 2018, Mr. Wilson signed with actor-producer Laurence Fishburne's film From Cinema Gatsby to produce a documentary film on Jason's work. It is scheduled to be released in 2001. Mr. Wilson has over 25 years of martial arts experience, in addition to over 16 years of training and developing young Black males. Mr. Wilson is a man of the Most High, a faithful husband of over 22 years, and a proud father of 2 beautiful children. Good afternoon, Mr. Wilson. Thank you for joining us, my brother.
It's an honor to be here. Thank you for having me. And can you hear me well?
Yes, sir.
All right, great. I'd like to thank Dr. Black. I'd like to thank him for stressing the importance for men to be transparent and vulnerable, because that truly is our pathway to emotional freedom. It liberates us. And I'm seeing, this like, I'm getting so many messages from men, especially on social media, who are terrified to express the fear that they're feeling right now. Of course, when the COVID pandemic first started, but now scared to be able to ride their bike or go to the store because they fear being brutalized by the police. And so, like always, I say that, suppression leads to depression. And that's what so many men are dealing with. And so I want to run through this deck real quick, because I know we're up against time. And I always love using visuals to help teach, especially men. So let me share my screen real quick. Make sure this is right. There we go. All right, can you guys see that, Royal?
Yes.
You can, I couldn't hear you. Can you?
Yes.
Okay, great, awesome. And so I just want to talk about emotional incarceration and how to break free from it. Again, emotional incarceration is a mental jail cell where we as men can hide the way we feel, but yet it's still a place where it's very unhealthy, where we tend to condemn ourselves, where we shut off the world and prohibit the type of care and love that we need to actually escape from this incarceration. I released a book last year called Cry Like a Man, and I had no idea of how many men were suffering from being emotionally incarcerated, unable to express how they feel. And I think the dedication is to every man who is tired of not being able to say they're tired. And when the book released, so many men from just, the average guy to celebrities have come forth saying, hey, I'm tired of being, I can't express myself. When I do, I'm impassively dismissed by my significant other, or I'm called weak by my peers or my friends. And so this book not only is starting a very needed conversation, but like Dr. Black said, it's destroying the stigma associated with mental health and the Black community. And so I just want to touch on the culture and how our culture as a whole plays into this role of what I call misconstrued masculinity, or basically a misunderstanding of what masculinity is. So this is me, like most of us, we grow up innocent, willing to smile, willing to express the comprehensive nature of how God created us. But misconstrued masculinity locks us into a one box where we're limited to only masculine attributes. And so I came up during the hip hop era, I call it the golden years, late 80s and 90s. And these were the typical album covers that we would see as young men. No smiles, no, the range of emotions was limited to just being hard or tough or frown the face. If you get caught looking soft, you would get beat down. There was actually a song by E40 called I Had to Practice Looking Hard. And so the culture actually created this new me. Now that the smile went away, the kind-natured heart that I had, that I was caring and wanted to mentor kids in the community, I had to hide that because I feared being considered soft or smart. I can remember many times I literally shrunk back from, like, I could spell words, with ease, but yet I purposely would misspell words so I wouldn't appear smart. And so we have to deal with the culture as well. And if we look at the data, the Cave of Adullam, or the Kata, we work with boys. Our mission is to teach, train, and transform boys into comprehensive men who are physically conscious, mentally astute, and spiritually strong enough to navigate through the pressures of this world without succumbing to their negative emotions. And so the data says that in just about every country, men die by suicide about 4 times as often as women. And when I ask men this, when I speak in conferences nationally, I say, there is definitely a different dynamic to the stress that we face as Black men in this country. But however, what is the major difference between what our sisters deal with, who they deal with a lot of pressure as well. And so they would yell out stress, anxiety, depression. And I would say, don't we all deal with these things? And they was like, yes. I say, the difference is women express themselves, we do not. We suppress it. Dr. William Frey, after his study, he discovered that tears from emotional stress or trauma not only contain 98% water, but also stress hormones. That's why we typically feel better after we cry. Another alarming statistic that came out recently is for the first time in history, Black boys 11 years of age and younger die by suicide more than any other race. Since actually pre-COVID, I remember it was a period of time, maybe about 2 weeks, I received at least 5 or 6 calls from parents terrified because their sons were contemplating suicide. And that's another reason, Dr. Black, I'm thankful for you because we need so many more Black men like yourself who are counseling our boys. And I definitely need to connect with you once this is over. But again, let's go back to the culture. So this is the rapper Drake. He says, I pop bottles because I bottle my emotions. So in other words, he's saying I get drunk because I don't express the way I feel. But our kids can't discern the foolishness in this statement. And just to be real, majority of men, we do the same thing. It may not be bottles, but it's pornography. It's high risk behaviors. You know, you can go down this list. And so I want to show you a slide of one recruit, young man who came to my office. And I took this, and this was maybe at least 2013. His mother was sitting to the right of me crying. And clearly he was cutting himself. And if he wanted to take his life, he could have easily hit the radial vein, but he avoided it. And I after just about maybe 20 minutes of allowing him to express how he felt, we were able to trace this cutting to him not having affirmation and love from his father. Once we were able to deal with that and give him the affirmation he needed from other men in the community and his family, the cutting stopped and he graduated high school. Another prime example of what the danger of being emotionally incarcerated or constipated as well is the Steve Stevens. I don't know if many of you remember this brother. It was called the Easter Massacre, where he basically broadcast himself gunning down beautiful elderly man, Robert Godwin. And he says in the video, and I kept it, we just don't have time to go over it. He says, too many people basically dismiss how he feels. There's still no reason for you to go out and kill an innocent man. I just want us all to see the danger in buying into this masculine attribute as the only attribute that we as men can operate in. And so one day, God told me to look up the word masculinity. And when I did, clearly, I'm like, well, wait a minute. I thought it was like a comprehensive definition. Let me go back. It moved too fast. Hold on one second. Let me go back. All right, here we go. And so it simply means having qualities traditionally ascribed to men as strength and boldness. Traditionally is a key word in that definition, because if masculine attributes are strength and boldness, that means our ancestor Harriet Tubman was masculine at a moment. And so why is it that we as men allow, Black men especially, allow ourselves to be defined by this? It's cultural. Many of our fathers and grandfathers and great-grandfathers are just 4 to 3 generations away from slavery. All they knew how to do was to protect and provide. And so that's why I encourage men who have the father wound, who have a bad relationship with your father, and that is the main reason you're staying emotionally incarcerated, to go back and reach him, Sankofa, go back and help him heal, because he didn't have a Zoom. He didn't have the opportunity like we have right now to discuss how he feels. And a perfect example of when we allow ourselves to be limited emotionally, the Pit Bull Terrier, this dog here in my era was only known for fighting and protecting. Now, as a result, this dog became very unstable, attacking children, killing children, mauling people. It was banned in many cities. And if we hadn't had the help of like animal rights groups and I forgot the name of the dog rescue organization, we would have never known that the Pit Bull Terrier is also a loving companion and family dog. When we box ourselves into just being strong and bold and not allowing ourselves to be compassionate, yes, be courageous, but be sensitive. Yes, be strong, but be comprehensive. Once you break free from your fears of being transparent and vulnerable, as a man, you're able to live from your heart instead of always living from your fears. I ain't gonna go after this job because I think I'm not gonna do well in the interview. And that's a deep result of your father not affirming you. I don't wanna ask this sister to marry me because I don't think I'm good enough. Now you're blowing an opportunity to really establish community and bring back what's needed, which is the family, the Black family unit. Next, and then I think I'm pretty good on time. Physical training is very important. However, you know, being emotionally unhealthy or mentally unhealthy is very dangerous. This is my best friend, Daryl. Amazing, one of the strongest men in Powerhouse Gym. I admired his physique. I admired his strength in the gym. I admired his love for his daughters. He was a very loving and sacrificial father. I admired his sacrificial care for his mother. His mother, whatever she needed, he was there. He was always the rock in that family, as she said it. I admired how he gave to others. Unfortunately, my best friend didn't give to himself. And he passed in 2004 of a massive heart attack, dropped dead on a job with us because he was stressed. He had got laid off from General Motors and just going through a lot. And he didn't tell us that he was having chest pains. And it breaks my heart. I had to hunt him down to say, what's going on? And I just wasn't awakened then to the power of being emotionally free, to get my brothers to get counseling and help. I could have, it's another reason, Dr. Smitherman can attest to this. It's another reason why so many of us men do not get prostate exams. That's like insane because we think it violates our manhood. All of these lies and deceptions are attributed to us being boxed into what my friend calls like the mask of masculinity. We allow the world to see Batman, but we're scared to allow them to see Bruce Wayne. But we're nothing but human beings. So as a result, our brothers are breaking down. And many of them we know from local, and they gave me permission to use their images. This is Brother Tafuri Brent, well-respected activist in the community of Detroit, and a supervisor at Ford. But here it is, here he had to go to the hospital because he was in bad shape and could have died. This is a good friend of mine, Shaka Senghor, which many of you know, New York Times best author and best-selling author. He writes that, and I just keep it short, he was in urgent care. Turns out the sinus infection spread to his lungs and would have turned into pneumonia, which the doctor said would have gotten progressively worse had he had not come in that day. More of the story, listen to your body and to your friends who encourage you to take care of yourself. As long as we boxed in and we don't allow ourselves to be vulnerable to say, man, hey, my chest is hurting today. Hey, man, I felt like I was about to faint. Then we can say, let me take you to my doctor. I have a great doctor, Anthony Clark. I refer all of my friends to him. This is another beloved brother, Joe Williams. He told me, he said, if I knew I would live this long, I would have taken better care of myself. How often, my brothers, do we see this image where the wife is upbeat and energetic and able to walk around, but the husband can barely move? He has a walker. These are images I take. I have tons of them because it grieves me because we allow our worth to be we allow our work to identify our value. And as a result, we can't hardly be there in the future when our wives get old and our children get old. And as you can see the gap here in this image, this is actually what happens to us when we're called upon. Here, I don't even know if we have time, but I'm just gonna play the video and go by it. But this is a father, he's 71 years old, and this is an initiation test that this is us use. As you can see, he could barely push up his son. But as a community, when we support each other, now he's able to do it. When we're there for each other, he's able to do it. But if he had been in bad health, he couldn't even do what he's doing now to show his son that he'll not only push him up in this exercise, but support him throughout life. And let me just run through this. So escaping the grinding mentality. So many of us wear the trauma like it's a badge of honor and the whole thug lifestyle. I have an acronym for thug. It's a traumatized human who's unable to grieve. And it's sad because many of our young Black men feel that the only way they can cry is by putting tattooed tears on their eyes. And it's so unhealthy, and the grinding mentality that I always have to work. I always got to get it in. But if we, again, look at its definition. Life and death is in the power of the tongue. Grinding means to wear smooth or to sharpen by abrasion or friction, to reduce to fine particles as pounding or crushing or pulverize, to oppress, to torment, to crush, to grind or pour. Now, it's amazing how everyone who says that they're grinding typically look worn down, look crushed, look like they're barely making it because their whole life is a hustle. That's not how it's designed to be. A good friend of mine, Laurence Fishburne here, I was out with him in California. He's a very busy man, but I learned something so valuable from him in just 2 days together. He has mandatory where he goes to a spa, release, reflect, and reset. He does it every day. It's mandatory. So here it is. I'm making excuses and I'm too busy to do the things needed to help me to stay mentally sharp and emotionally there for my family and my community. And here's a man busier than I am who makes it mandatory. A couple of things that can help us, and I can close. One of my favorite scenes in The Matrix is at the end when all the bullets were coming at him from the agent. Before, when he was trying to do everything and stand there, he got shot and died. But once he understood the power of saying no, the bullets stopped. The first one we have to deal with as leaders, especially, is people pleasing. Always having to be there for an emergency. Sometimes the best way to put a fire out is to allow it to burn. Number two, anxiety, the stress that we hold to just trying to reach everyone and taking away from ourselves. And I always say, you know, your cup will stay empty if you keep moving it. God can't fill a cup that keeps moving. Lastly, a fear of failure. That is a result, wish I had more time to talk about it, of the father wound, how it stops us from really going beyond the limits of our mind and really living from the heart and the desires that we have. So let me close real quick. I wanted to show the end scene there, but let me deal with my 4 R's so I can give us some action steps. The first is reflect. Meditate at least 30 minutes a day. This is actually me this morning. I felt the heaviness of just everything that's going on, from the murder of my brother George Floyd to everyone just grieving and the stress that our kid. I had one of my students call me saying he's scared to run in his own neighborhood, and he stays in Southfield. He's going to college for track, but he's scared to run because of what happened to Brother Amar. So I had to help teach him how to release that emotion. Also, meditate at night. Meditate in the morning, meditate at night before you go to bed so that your thoughts will calm down. I wish I had more time to talk about that. Number two, release. A minimum of 4 counseling or therapy sessions a year. And I'm going to show you what I mean by therapy. This is my counselor. Like, ideally, like Dr. Black said, I would want someone who looks like me. But let me tell you, this man right here is Dr. Tim Bro. He not only helped save my marriage, but he helped me become a comprehensive man. And I love him like a father right now. Dr. Tim Bro, when I first got the call, and this is comical, my wife says, you know, he's a good counselor. I said, what's his name? He said, Dr. Bro. So I thought he was a brother because it was bro. But clearly he's a brother from a different mother. But he is, again, my brothers, do not allow the skin tone of another man to stop you from getting the healing you need. This man knows trauma. He don't know the Black community, but he knows trauma. If you're transparent and vulnerable, they can help you. So don't shut the door on that because you can't find a Black therapist. Another thing, if you're married, look, that's Dr. Bro and his wife. They helped us, me and my wife, to connect and get past so many wounds that we had. We've been married 22 years now. This was 2015. We were considering separation because we just couldn't get past the pain. But because when I became comprehensive and broke free from emotional incarceration, she was able to see that all of my reactions was rooted to hurt and pain. And then I was able to say, instead of hitting the table, I would say, wow, babe, that hurt me. You don't trust me with the finances or whatever it may be. And now she can connect because it's not a threat to her. Now, when I say therapy, if you're in Detroit, write this down. It's called Inception. It's the first mental health gym. It's in Farmington Hills. It's owned by my friend David McCulley, just partnered with Charlemagne. They're going to make this mental health gym national. You have to go and do other things to help your brain and body relax. This here is called neurofeedback training, which actually resets the trauma that you've experienced. And this is called flotation. I can't think of the term, but it's float therapy, where your body actually shuts down all 4 senses so you can get a deep relaxation. It's like 1 hour in this tank is 4 hours of deep sleep. And this is my saying, no pain, no gain is not a universal principle. If you apply it to every area in your life, you will soon not have one. The third one is retreat. A minimum of 2 retreats a month. What I mean by that, you can't get away to Hawaii every month like that. You know, I wish I had the money to do it, I'd be gone. But retreating, riding your bike, this is therapeutic to me. I spent all this money on a bike that stayed in my garage because I had to keep serving the community. Then I noticed why my mind, my thoughts were just bombarding me and I felt stressed. Like, why can't I just release this anymore? Because I'm not taking care of myself. Sometimes I'm alone, sometimes I'm with my friends. This is my friend Dante. He's a very successful businessman, and he has 7 beautiful children, stay-at-home mom, wife. His wife is beautiful, works hard, homeschooling, and he has to get away. He takes time to go fishing. These things, my brother, we have to get back to. Everything doesn't have to be work. We need to work. We need to work from our rest and not vice versa. And lastly, rest. A minimum of 7 hours of sleep a night. I think it's the Division of Medicine at Howard Medical School. It says a lack of adequate rest not only affects our mental health, it has a big impact on your physical health as well. When we do not get 7 to 8 hours of quality sleep, it can heavily influence your outlook on life, energy level, motivation, and emotions. This is one of the groups we had in the Cave of Adullam. And this one day we were about to go to training, and God says, call the fathers on the mat and tell them to lay down and meditate. So often we teach our kids, especially our Black sons, work ethic, but we don't teach them rest ethic. And so within a matter of minutes, these men fell asleep. And so while they were asleep, I had their son sit up and we start talking. I said, look at your fathers. Do you ever see them do this at home? And they say, no, they're always working. So we have to teach by example, because again, as a Black man, and I've been guilty many times, my wife would come home and I'm taking a nap and I would jump up like she the boss, like I'm scared to be seen taking a nap. My wife wants me to rest because she loves me. She wants me to be here. But as long as I buy into this grinding lifestyle and always having to work to prove my worth, I will die before my time. Let me see here. I don't know how these got in here. This is my beloved son, but I think that's the end of it. But let me close out here. Let me exit here and then stop sharing my screen for questions. But that's pretty much it in a nutshell. I wish I had more time.
I wish you had more time too, Brother Wilson. We are, Dr. Burns, see if we have at least one question in the chat room, because if not, we're going to move on to Dr. Smitherman.
Yes, it says the COVID pandemic has brought a lot of stress upon families with respect to children and their relationship with their fathers. What would you say to men who may have been involved with domestic violence involving their mates and children?
Had a situation like this on Facebook. A guy reached out to me. I told him to take walks with his son to explain to him what happened, and then be transparent with his son. Because this is where the divide comes between father and son, when the son doesn't see really what the father is feeling. So as long as we appear to be one way, the son will eventually resent the father, because he's going to always protect mom. And for men, you have to get out of the house. You have to take walks and to clear your mind, because especially if you're not having counsel or therapy, you're going to take everything out on your wife and your kids who love you. And so that's what I would suggest. Open up to your son or your children there, explain to them exactly what's causing you to be irritable and have less patience. And then for your self-care, take time out to walk around the block if you have to, just to decompress.
Thank you, Jason. We appreciate you being with us this afternoon. We are going to move right along to our next presenter, Dr. Smitherman. Dr. Smitherman is Vice Dean of Diversity and Community Affairs and Associate Professor of Medicine at Wayne State University School of Medicine. He is also President and CEO of the Health Centers Detroit Foundation, the first federally qualified health center lookalike designated in Detroit. Serving the underserved and uninsured in Detroit and Wayne County for more than 3 decades, his research focuses on health issues related to underserved populations and their access to appropriate health care in context of the United States healthcare reform. Dr. Smitherman received his Bachelor's of Science in Chemical Engineer with a major in Biomedical Engineering from Northwestern University. He completed his medical degree at the University of Cincinnati, his Master's in Health Services Administration at the University of Michigan, and completed special coursework in International and Healthcare Economics at Amish College and Harvard University. As an international Somberg healthcare fellow. He participated in the 2002 Australia seminar. Dr. Smitherman is widely published, including co-authoring a healthcare policy book entitled Taking Care of the Uninsured, A Path to Reform. Dr. Smitherman is also recommended to President Obama for the position of United States Surgeon General in 2009. Good afternoon, Dr. Smitherman. You there, Dr.
Oh, yeah, I've been trying to unmute here.
All right.
I've tried to share my slides. Can you see them?
Yes, sir. It's up.
It's up. Okay. So let me go here. So I was asked to talk about general health care, personal health care, et cetera. The title of this is Man Up, and for better health, especially for African-American men. And that's man up despite the proverbial knee on our neck. And we still, even though we have oppression, even though there is neglect, we still must be healthy. And I'm going to talk about that in the context of community health and also your personal health. As of 2015, the average American lives about 8 years longer than they did in 1967. But is this reflected across all segments of our society? No. If we look at infant mortality rates, death rates, maternal mortality, that's the deaths of our moms, life expectancy, all of these have improved, but the gaps have widened between Blacks and whites over the last 50 years. For example, life expectancy for whites was 7 years higher than Blacks in 2015, compared to 6.5 years higher in 1967. So although whites have much higher life expectancies, actually those life expectancies are expanding. Infant mortality rate, or the death of our babies, in 1967 was 47% higher. And now it's 55% higher in 2015, twice as much as whites. Maternal mortality, these are the deaths of our mothers, Black mothers giving birth, is 3 to 4 times higher in Black women compared to white women. And if you look at all-cause mortality, the top 10 causes of death, in 1969, Blacks had a 15% higher all-cause mortality than whites, and that gap between Blacks and whites has widened to a 40% higher all-cause mortality. And also, if you look at chronic disease, and all ages younger than 75, Blacks had higher rates of heart disease, cancer, strokes, diabetes, et cetera. And the concern was, the conversation when COVID happened was that even Tony Fauci started the conversation that African Americans have higher death rates of heart disease and cancer and cerebral vascular disease and strokes and diabetes and HIV. That's what's driving this. No, that's not what's driving this. It's what caused the increased disparities of heart disease, stroke, diabetes, et cetera, in the first place. We've gone through public policies, enslavement, lynching, Jim Crow, mass incarceration, police brutality, social and economic oppression and neglect. This is about social and economic public policy. And if you look at the impact of social policy in our communities, cuts in community health centers and healthcare in Black communities, closure of hospitals in Black communities, bank home foreclosures, cuts in college aid, cuts to the disabled, cuts in public education by 20%, unfair criminal justice, cuts in the earned income tax credits, which has been the most significant anti-poverty program in the history of the United States, cuts in housing and HUD, job training, Medicare, Medicaid, mental health services, mass transit, medical research, especially as it relates to Black and brown, nursing home, cuts in nursing home care, especially in Black and brown communities, cuts in Planned Parenthood, cuts in food stamps, cuts in school lunch programs for inner city kids, cuts to school loan programs for minority kids, cuts in after-school programs and Social Security, and at the same time, cuts in Head Start program, one of the most successful public policy programs we've had also in the United States, and tax breaks for oil, mining, agriculture, banking, offshore companies. And a decrease in a fight against minimum wage. This is public policy. These public policies have translated into poor health and community conditions in Black and brown communities. If you look at one policy over the last 10 years, and that is the passage of the Affordable Care Act, and that is Obamacare, 9 presidents from 1853 to 2010, that's 157 years, attempted to enact broad healthcare reform. And only Lyndon Johnson in 1969 passed Medicare and Medicaid. Other than that, broad healthcare coverage for the American public had not occurred until 2010, where you see this president sitting here signing the Affordable Care Act, March 23rd, 2010. Why is this important? Because prior to the ACA, we spent about 2.6 trillion on healthcare. We spent more than any country in Europe and Canada. We had almost 50 million people without health insurance, with those without insurance having a 25% higher death rate. We had high costs. We had almost 100,000 excess deaths attributed to the lack of health insurance, and 70% of those deaths in the United States were due to chronic illness. After ACA was passed, we're spending about $1 trillion more, but we covered through 30 million additional Americans gain health insurance under the ACA, most of them Black and brown, and small business owners. If you look at uninsured rates by race and ethnicity, you can see these lines. These are the percentage of adults aged 18 to 16 who lacked insurance in 2010 and where they are in 2016. There have been significant decreases in the rates of uninsured, especially in Black and brown communities. This is called positive public policy that improves overall health status in this community. I wanted to show you a slide that looked at the demographics, a cardiographic demographic slide of where African Americans live in the United States. And if you look at the darker, the purple, the red, you see that a large part of our population is in the South. Next slide. These are, if you look in orange, these are the states that have refused to implement the Affordable Care Act. It has not been adopted. I just want you to look at where we live and where Obamacare or the ACA has not been expanded. You got that slide?
Yeah.
And if you look at the population, Michigan, we've had actually a 50% improvement in the number of people who are insured. And if you look at the United States, we've gone from almost 45 million uninsured down to 17 million uninsured. We've had a decrease of about 40%. Now, transitioning that, and now transitioning to personal health. This is a definition that I was involved in the 3rd African-American Health Summit in Dakar, Senegal, West Africa in May of 1995. These are African-American health leaders and African health leaders from across the continent of Africa. And one of the definitions I modified as I spoke to that group of people, I modified the 1948 World Health Organization definition, which talked about health as a state of complex physical, mental, and social well-being, and not merely the absence of disease. What you see in light blue is what I added to that. And health also includes not only a community that is physically and mentally healthy, but also socially, economically healthy, and also spiritually healthy, and the well-being of the individual, not only the well-being of the individual, but also their community. If you look at the causes of death in the United States, 51% is our behaviors, community conditions of living, and our lifestyle. About 20% is our human biology, our genes, 19% environmental. Lack of medical care, that's what I do every day, provide medical care to people, only impacts health by about 10%. Most of what impacts health is our lifestyle and lifestyle choices. And these are health-related behaviors and community conditions of living: poor diet, nutrition, sedentary lifestyle, substance misuse, addiction, especially tobacco and alcohol, stress-related conditions, including violence, suicide, and reckless behavior, and sexual behavior, HIV/AIDS, and not wearing protection. This accounts for 50% of all premature deaths in the United States, 33% of all acute disability, and 66% of all chronic disability. But what is lifestyle? Lifestyle is a composite expression of social and cultural circumstances that condition and constrain behavior. It's not just simply the personal decisions that individuals make in choosing one behavior over another. So if you are constrained in your community by no housing, no appropriate health care and ambulatory care, your public education system has eroded, your school lunch program has been eliminated, there's no mass transportation, there are no mental health providers in your community, there are no job training resources in your community, there's no aid for college, etc. These are social circumstances that condition and constrain behavior and limit your ability to make personal, positive decisions about your health. Heart disease, still the leading cause of death. These are the top causes of death in the United States. Heart disease, cancer, and stroke are the leading causes. But if you look at these, those were the disease syndromes. These are the actual etiologies or causes. Tobacco is still the #1 cause of death in the United States, and diet and inactivity, #2. And if you look at where illicit drugs are at the bottom, we talk about it is less than 1% of the cause of death in the United States. But look at what resources we spend on mitigating illicit drugs versus how we enhance the distribution of tobacco. This is called public policy. Chronic diseases, chief causes of death, 82% of all deaths are due to those top 10 causes. Actually, 62% are due just to heart disease, cancer, and stroke alone. And Michigan has one of the highest rate of heart disease. It ranks 2nd for obesity and diabetes and ranks 6th for smoking. And we rank 34th among the 50 states in life expectancy. TLC, what does that mean? Therapeutic lifestyle changes. Tender loving care equals therapeutic lifestyle changes. What is cardiovascular disease? The two important types of cardiovascular disease is high blood pressure, coronary artery disease. And if you look at their risk factors, tobacco use, being overweight, sedentary lifestyle, high blood pressure, cholesterol, diabetes. And if you look, heart disease can be prevented. We must deal with behavioral lifestyle, quitting the smoking, reducing and maintaining weight, eating healthy, limit our alcohol consumption, and exercise. And especially tobacco. It's the #1 cause of death. If you smoke, you got to stop. If you don't smoke, don't start. And limit alcohol. Actually, ethyl alcohol more than 1 ounce a day raises blood pressure and causes heart disease. And we must modify that. It's 1 ounce of alcohol or anything more than 2 drinks daily, and 1 ounce or half an ounce for a woman. High blood pressure, 50 million Americans have it. About 25% don't know they have it. And it's a silent killer. Most people don't have symptoms. For African Americans, hypertension develops earlier in life and is more severe. It is high blood pressure as a disease syndrome is the #1 cause of death for African people, the entire African diaspora. High blood pressure, #1 cause of death. Obviously modifying our sodium, because many of us are sodium sensitive. And if indeed with diet and exercise, we cannot modify or decrease or normalize our blood pressure, lowering your blood pressure with medications is critical. It's harmful because it enlarges our heart. It causes arterial damage and heart attacks and strokes. And kidney disease, what the two measures mean, systolic blood pressure and diastolic blood pressure. The systolic blood pressure means what's the pressure, because the heart is simply a pump. What is the pressure in your vascular system when the heart contracts? What is the pressure in the vessels when your heart contracts as a pump and pushes the blood into the vascular system? The diastolic pressure, the second number, is what is the pressure when the heart relaxes? What is the pressure in the vascular system as the heart relaxes? Normal blood pressure, we want that less than 140 over 90 millimeters of mercury. Optimal blood pressure is 120 over 80. And we clearly, for those with diabetes, want to have a goal for blood pressure less than 130 over 80. The causes, predominantly the causes of lifestyle choices, poor diet, lack of exercise, etc. There are obviously genetics associated with this. Obesity increases high blood pressure, and excess alcohol also is a direct cause of hypertension. Cholesterol, bad cholesterol, the LDL, or the low density lipoprotein. Good cholesterol, HDL. So we want a high HDL, which takes the cholesterol, deposits it in the liver and gets rid of it. And we want a low LDL, which deposits cholesterol in the arteries. The LDL, oftentimes people think it's a number we get from the blood. It's actually calculated using your total cholesterol minus your HDL plus your triglycerides divided by 5. This is how we calculate your LDL, or your bad cholesterol. Cholesterol is bad because its deposits lead plaque buildup in the arteries, and plaque blocks blood flow and causes heart attacks and strokes. The risk factors, when your cholesterol is high, age, family history, diet, smoking, high blood pressure, low HDL, diabetes. And let me tell you, these are not simply additive, they're multiplicative. So that curve goes up exponentially if you have cholesterol in association with these illnesses. And cholesterol numbers, you want total cholesterol less than 200. You want triglycerides, actually, there are new guidelines, you want that less than 150. LDL less than 100. And your HDL greater than 40. If you are someone or someone you love is at risk for diabetes, here are the risk factors: age over 45, family history of diabetes, being a member of an ethnic group. African Americans, Latinos, Native Americans, and Pacific Islanders have an increased risk of diabetes, and women with a history of gestational diabetes or diabetes during pregnancy also have an elevated risk. You want your blood glucose never to be greater than 140. You want your fasting plasma glucoses below 110, definitely below 126. And evaluating your heart disease risk, we look at blood pressure in association with all of these other risks: cholesterol, diabetes, diet, weight, exercise, etc. You also want to exercise 30 to 45 minutes of brisk walking most days of the week. And I always tell people, weight loss, if you're losing 1 to 2 pounds a month over a period of time, 1 to 2 pounds a month is excellent weight loss. Appropriate diets, again, limit the salt intake, limit saturated fats and cholesterol. What we want to do as far as an adult maintenance guidelines and exam, you should have a health exam every 1 to 2 years. Basically, height, weight, BMI, body mass index, blood pressure, assessment of tobacco, diet, exercise, substance abuse, a depression assessment, additional exam you see there, screening. This is for adults. So women, pap and pelvic, chlamydia screening, mammogram, testing your occult blood for colon cancer, and a colonoscopy every 10 years. If it's abnormal, we do it more frequently. And a PSA in men. You should have complete blood chemistry at least every 1 to 2 years, and a chest x-ray and an EKG every 1 to 2 years. For men, definitely high blood pressure. Like I said, the #1 cause of death worldwide for people of African descent: diabetes, high cholesterol, coronary artery disease, smoking, exercise, diet, and alcohol misuse, and cancer screening, prostate and colon. For prostate, the incidence for prostate illness in Black men is significantly higher, and the mortality is significantly higher. This is a pictorial. It talks about the evaluation for prostate cancer. We do two tests. One is the PSA, which is a blood test, and the other is the rectal exam. Why do we do the rectal exam? If you look at this anatomy, you see colon, you see the rectum, you see the urethra, you see the testicle, and you see the bladder, and you see a big red little walnut in the middle called the prostate. What we're doing is we're putting our finger in the rectum to try to evaluate if there's any enlargement or masses on the prostate. So at stage A, which is an early stage of prostate cancer, you see a little dot. If I place my finger posteriorly, most of the cancers in prostate will present posterior, although some will present anterior, which I can't feel on rectal exam, which is why we do this blood screen and the PSA. You see the little dot there, that's the initial stage. This is a larger stage, but it still hasn't, the cancer hasn't broken through the capsule of the prostate. Sometimes we can feel a little nodule. This is when it's spread beyond the prostate. You have a lot of symptoms, especially constriction of urination, dribbling, difficulty urinating, and sometimes painful urination. And this is when it's metastasized past the prostate into other organs like pelvic nodes, bones, etc. The finger is placed in the rectum to try to identify whether there's a mass on the prostate. Very, very important. As I said, higher incident, higher mortality in Black men. And unfortunately, this is one of the tests that precludes African-American men coming in to see the doctor. But it is critically important because we die at a much higher rate of this disease. The finger is placed to try to identify if there are lumps and bumps in the actual prostate organ. The end.
Thank you, Dr. Smitherman. Dr. Burns, do you have any questions in the Q&A?
I have one. We did do a poll about safe sexual practices, and 62% who were polled said they were knowledgeable. And then we also did a poll of do they feel comfortable sharing information with their healthcare provider? And 97% who were polled said yes. The only question that we have can Dr. Smitherman stop sharing his screen real quick?
Oh, how do I do that? Now. Okay, let me just do this.
Okay, we had one quick question. Oh, the button down below, the share screen on your toolbar, or just push stop. Yeah.
Push stop. Let's see. I have share.
Stop.
Let me see. I don't know. I see. Did it stop?
No.
Crap. I say new share. Resume.
Look at the bottom of your screen.
Yeah, I see the oh, stop share.
Okay.
Very good.
Okay.
Okay, great. We just had a quick question about marijuana. You gave a great presentation on everything in terms of general health. Is marijuana helping our culture? Is marijuana helping our culture be cognizant of their behavior?
Okay. Is it helping our culture? First of all, I don't have a particular problem with marijuana. It is a medicinal drug. It is just like we give benzodiazepines or other sedatives. It is predominantly a sedative. If it's used in the privacy of your home for sedation, and you're not in any kind of, you're not in a job where you're required to be in high heights doing some professional thing, or you're driving a car or anything else, I don't think it's constructive or productive doing that. But if you're using it to help yourself relax in the privacy of your home, that I think is appropriate. And personally, it's not something that I would necessarily take if you're talking about trying to do something that is significant, doing presentations, etc. But I don't have any, I don't think there's any medicinal problems with the use of marijuana, as long as it's used responsibly. I don't advocate it, but I don't have a problem with it. And my patients come to me, ask me this question all the time. Doc, can I use marijuana? I go, well, you're already using it. Nothing I say is going to really change that. But as long as you use it responsibly, please do that.
Thank you for being honest.
Huh?
Thank you for being honest.
Yeah.
Open.
Thanks, Dr. Smitherman. I appreciate you. Dr. Burns, any other questions? Because we're going to wrap things up. If not,
I have one general question. If you could answer it fairly quickly. We have a question about food deserts and the negative health outcomes in Black and Brown communities. What are your thoughts about that?
Well, first of all, appropriate nutrition. I mean, obesity is the #2 cause of death in the United States. And a lot of that is we have poor food choices in our community because we have food deserts. We don't have appropriate, vegetables and fruits and the kinds of stores that support our community. And that is a significant problem. This is public policy. This is what, our public leaders and public health leaders should be advocating for. And hopefully what we see in the protesting that we see occurring now, and that these very, very courageous young people, we as adults in our community and additional people who have positions of influence, we have to translate those appropriate protests into public policy, like ending food deserts in our communities. It's about public policy. And in order to get appropriate public policy, you got to vote and hold them accountable.
absolutely, sir. With that said, we are going to wrap things up for today. I really want to thank all of our panelists. We thank our Lieutenant Governor, Gilchrist, for participating. We thank Dr. Holley Jr. We thank the Detroit Police Chief, James Craig, Jason Wilson. Thank you, Dr. Smitherman, and Dr. Branch. We appreciate you for participating with this. This is our first virtual Men's Health Summit, and it may not be the last because of the questions and participation that we had for this event. Also, would like to thank Dr. Jade Burns from the University of Michigan and the DRB Lab, the Curtis Center at the University of Michigan School of Social Work, our president and CEO of Detroit Community Health Connection, our board of directors as well. Thank you all for participating in this Men's Health Summit. Dr. Burns.
Thank you, Derek. Thank you to all of our panelists. Thank you to all who participated in this wonderful event. This is already on Facebook Live, and we will be sending you a thank you through your emails. So we have an additional resource sheet that has a lot of these things already on that sheet, and we will send that out after this event, and the survey as well, so answer that. I think that's it, Derek. Everyone did a phenomenal job. I hope everyone learned so much. There was a lot of comments on Facebook Live. People said, I'm so glad they just happened to be watching it. So excellent job to everybody. So I hope we
I have one other thing to add. The Director of Office of Minority Health wanted me to make sure that I advocated to everyone about the census, filling out the census, because that's how we get a lot of resources in our community. So if nothing else is needed to say, this will conclude our Men's Health Summit. And once again, I did not give a shout out to Asha Freeman, who helped us with our log on for Zoom. We appreciate you, Asha. Thank you very much.
Thank you, Derek, as
Yes.
well. Happy Father's Day to everybody.
Thank you.
Happy Father's Day to my husband as well.
Enjoy your Saturday. Thanks.
Take care.
Thank
We'll talk to you.
Bye-bye.
Bye.
Bye.
Okay, thank you.
Very nice area.